Hi everyone, I'm glad you're here. Thank you very much for joining me. Many of us in the prepper community are probably surprised that Biden and his administration are now becoming preppers. This would be a real good wake up for people who are not prepared for any type of disaster. Even though Biden and his administration are late to the game, this probably won't affect us that have already been prepared. There will be a rise in cost of goods and medicine, medical supplies, food, things like that. Yeah, inflation is definitely out of control. So for the prepper community, unless we're restocking our supplies, rotating our goods, the higher cost that this is going to create because of the government buying everything up won't really affect us that much. But people who have not been prepared, realizing that the government does see the need to be prepared for an emergency, a disaster, another pandemic, yeah, they're going to be paying the higher costs when you got a government buying up the stocks. On July 21st, on the whitehouse.gov webpage, it says that they were creating the Office of Pandemic Preparedness and Response Policy, OPPR. It's going to be a permanent office in the executive office of the president, and they're taking charge with the leading and coordinating implementation and action related to preparedness. Well, you know darn well whatever they stock up is going to be for government officials only and not for us. Their supplies is going to be only for the continuancy of government. Part of this plan probably would include another document that's on the Whitehouse.gov website. It's called the Hiroshima Action Statement for Global Food Security. Global food security is threatened by multiple factors and risks such as the COVID-19 pandemic, volatile energy, food and fertilizer prices, the serious impact of climate change, it says, and armed conflicts. Also part of the Office of Pandemic Preparedness and Response Policy. They're going to prepare for unknown biological threats or pathogens that could lead to another pandemic or a significant public health related disruptions in the United States. Yeah, remember all the disruptions where we couldn't get food, medicine, fuel, and prices just went sky high. They are going to continue the work to address potential public health outbreaks and threats from COVID-19, monkeypox, polio, avian and human influenza, and RSV. OPPR will develop and provide to Congress a biennial preparedness review and report and preparedness outlook report every 5 years. Major General Fredericks, who is retired, is currently the Special Assistant to the President and Senior Director for Global Health Security and Biodefense at the National Security Council. In the past, Dr. Frederick has also overseen the DoD Global Pandemic Evacuation System, supporting global medical care and numerous interagency, domestic, and global disaster responses. Some of the things that the Hiroshima Food Security Program will be doing will be to getting funding from international donors and private sector to fill emergency and critical development assistance funding gaps to avert famine and build sustainable and resilient food systems, to strengthen the agricultural market information system by supporting the G20 efforts to broaden its coverage to include fertilizer, vegetable oils, as well as improving data in provision, including on stocks. Supporting medium to long-term activities, including increased investment in food systems, be it production, food supply chains, including processing, distribution, cold chain, sustainable food environments, and consumer behavior, among others. They want to control what we eat and how much we eat, while promoting responsible investment, development of agricultural related infrastructure, such as storage, irrigation, transportation, connectivity, including rural infrastructure, especially for least developed countries, and in line with the World Trade Organization Committee, WTO, commitments to the Nairobi ministerial decision on export competition, also addressing water availability and security for agriculture, promotion of organic farming, climate-smart ecological natural-based solutions and ecosystems based on approach, and other approaches as appropriate, and scaling up support for smallholder and marginal farmers, including women and youth, to be linked to larger agricultural markets. Then I found this on the worldbank.org. It talks about domestic food inflation remains high around the world. This is dated July of this year, 2023. Food inflation is higher than 5% in 61% of low-income countries, 79% in low-middle-income countries, and 70% of the upper middle-income countries. Countries most affected by the inflation are Africa, North America, Latin America, South Asia, Europe, Central Asia. Then there was another article that was published March of this year. It says the state of U.S. strategic stockpiles. Joe Biden has tapped into the nation's emergency reserve several times over the past year. Yeah, up until recently, we were actually sending our oil to China. What is the Strategic National Stockpile? The SNS grew out of an earlier program, the National Pharmaceutical Stockpile, which Congress created in 1999 to serve as an emergency supply of drugs and vaccines in the wake of a terror attack or other crisis affecting public health. It was overseen by the CDC. In 2003, amid a sweeping government reorganization prompted by the 9/11 terrorist attacks, it became the SNS, and in 2018 was placed under the authority of another body within the Department of Health and Human Services, HHS. The SNS contains a slew of medical supplies and equipment, including antibiotics, antiviral, vaccines, ventilators, and beds stored in a secret location across the country to supplement state and local resources. The exact contents of the stockpile are kept secret for security reasons, but holds over $8 billion worth of inventory. The SNS has been used to respond to a range of crises since its inception, including the 9/11 terrorist attack, Hurricane Katrina, the outbreak of Zika, Ebola, H1N1, COVID-19, and more recently, Mpox, monkeypox, the smallpox relative formerly known as monkeypox. But because the SNS was initially designed and funded to handle chemical, biological, radiological, and nuclear events, experts including Burrell says it has not received the necessary funding for pandemic preparedness. During the Trump administration in 2017, they were readying the country for a bioterrorist attack involving smallpox, anthrax, or other deadly pathogens. Perhaps the most well-known stockpile is the Strategic Petroleum Reserve, an extensive oil storage system created in response to a 1973 oil embargo by OPEC. It is capable of holding 700 million barrels of oil in a network of underground caverns that run through Texas and Louisiana. In 2022, the Biden administration made a tremendous amount of withdrawal from the reserve in response to the Russian invasion of Ukraine and subsequent oil inflation. Well, if it was to keep down prices here, why were we sending them to China? The United States also maintains few lesser-known stockpiles. The Northeast Home Heating Oil Reserve is a stockpile of 1 million barrels of diesel fuel kept in Connecticut, New Jersey, and Massachusetts to supply the northeastern United States where the majority of heating oil is used. They used to stockpile helium, but they don't do that now. It was ordered closed in 2021. Additionally, the Defense Department reportedly stockpiles rare earth minerals which are used in the manufacture of advanced weaponry, and lithium, a critical input for advanced batteries, to curb its reliance on Chinese sources. The Pentagon also maintains a national defense stockpile of about $1.5 billion worth of various metals. The government has in the past stockpiled food, but these programs were mainly to support farmers hurt by low prices. For example, in the 70s and early 80s, the Department of Agriculture, USDA, bought surplus dairy products, which it distributed to Americans via various welfare programs. I'm old enough to know that when they did that, they gave, it was called a cheese giveaway, but it was cheese and butter that they gave away. Food stockpiling has been a point of debate in negotiations at the World Trade Organization because some critics say it distorts trade flows. We should not be part of that. Today, the USDA still buys various commodities for both domestic and international food aid programs. While domestic is probably for the military, for the continuancy of government, and then what they buy is what, we ship. Well, look at all the food we're sending to Ukraine, right? So some preppers might want to put this on their list to remember. It also maintains a vault in Fort Collins, Colorado, that houses thousands of plant species and genetic material of livestock in the event of a disaster. The SNS does not contain food reserves, but the Federal Emergency Management Agency, FEMA, stockpiles food, water, generators, and other resources across 8 distribution centers located in the United States and its territories. So the article says it's got 8, but it lists 10 here. So 2 of them do not have distribution centers. I'll give you a link to this and you can click on each region and see who's in charge. And then they got tribes and strategic plans and office and leadership, tribal affairs, how to pay FEMA. So all that's going to fall underneath Biden and Harris, the government, their preparedness plan. So what are your thoughts? Better late than never, I suppose. Please put your comments down below. Thank you very much for watching. Thank you for subscribing. Keep prepping. Please stay safe, and I'll talk to you later. God bless you. Bye.